video, the fantastic video we've seen, and the theme of Did You Know? And I think the idea of dispelling the myths that have surrounded cancer around the world is an enormous contribution from everyone who's participated in this commemoration of World Cancer Day. But we've also heard, alongside the hard facts, the dispelling of the myths, the personal testimonies. I think a collection of incredibly moving testimonies. As it's been said many, many times, cancer is so widespread that it touches everybody's life. And I think building that kind of empathy, the idea that it could happen to any of us, which is what empathy means, is being able to place yourself mentally in the position of somebody else, is a very, very powerful tool. And it's that empathy that I think opens the door to the second word that I heard repeatedly mentioned here, the word opportunity. The idea of moving away from this notion of cancer as a war, this militaristic analogy, which I don't think we in public health are particularly fond of, and thinking about cancer as a way of, as an opportunity to gain insight into some of the most fundamental challenges that we are facing. And part of that opportunity has to do with the third key word of today, the word integration. Cancer does offer the opportunity to break down many of these dichotomies that have divided us for many, many, many years. For some reason, we seem to like some of these dichotomies. I think it's a reflection of a very divided world. But we keep making those distinctions between public health and clinical medicine, between communicable and non-communicable diseases, between prevention and treatment, between social determinants and health care, between research and action. And I think cancer offers us an opportunity to integrate better and to think in a more holistic way and to go beyond many of those barriers and those silos. This is what the notion of the diagonal approach is all about, because one of those dichotomies, which has been particularly divisive in the public health community, has been the dichotomy between vertical approaches and horizontal approaches. The idea of vertical approaches meaning that, of course, if you focus on specific diseases, then you can actually mobilize support and be very, very specific about a series of actions and achieve great results. But with the disadvantage that we end up fragmenting health systems, versus the horizontal approach, which, although has the great advantage of asking for a general strengthening of health systems, has the disadvantage that very often we lose sight of the priorities. And I think the effort to deal with cancer globally offers an opportunity to really adopt a diagonal approach. I saw this firsthand in Mexico when I served as Minister of Health. We were in the middle of introducing a major structural reform that would create the conditions for universal health coverage, something that was achieved a few years later. We were trying to get the legislation approved, which did happen, start the rollout of this new insurance program. And I remember that one of the innovations was to establish a fund for protection against catastrophic diseases, and that was just based on good evidence, one of our keywords, that actually most people in Mexico were paying out of pocket. That there was a predominant way of funding the health system, despite the conception that we had a public system. In point of fact, the reality was that most people were funding their care out of pocket. And therefore, the notion that we needed to create a way of protecting families from the economic effects of becoming ill became a very central piece. At some point, after covering the treatment for HIV/AIDS, the next idea was to cover leukemia in children. And that was because in health we're always victims of our own success. So it turned out that given the great levels of coverage with vaccines, more and more children were surviving to the age where actually they could develop diseases like leukemia. And leukemia had become the number 2 cause of death in children from 5 to 15 years of age. At the same time, it was a disease for which there was effective treatment, leading, as you saw in some developed countries, to 90% cure rates. But it was also a very expensive disease to treat, such that we had found that at that point, about 30% of all families, of all patients that were starting on treatment for leukemia, 30%, a third, had to abandon that because the family ran out of money. And those were the most tragic cases, because those families became wiped out financially, and the child eventually died because the treatment had to be interrupted. So we zeroed on leukemia, and then in a great event, the first year after the new insurance scheme had started to be implemented, with the president of the country and everyone attending, we launched this accelerated coverage for kids with leukemia. And I was amazed at the number of people that came to me, people even working in the Ministry of Health, who said to me, so that's what you meant by universal coverage. They, even fairly sophisticated people, technically oriented people, who hadn't been able to quite grasp some of these abstract managerial and financial notions, and were finally, by addressing this one disease, were able to understand what this reform was all about. And I think that's the power of the diagonal approach, that it allows you to actually take a number of very explicit priorities and then build around them not only support and understanding and popular support, because then people can relate abstract notions of insurance and things like that to concrete deliverables, but also build up the health system. We saw that with these innovative financing mechanisms. We saw that with innovations in delivery. You saw many examples of innovating the delivery mechanisms built around the need to develop new responses to this challenge in resource-poor settings. And by the way, let me tell you that extending coverage for globally for some of these complex diseases has a benefit also for rich countries. We saw that, for example, with HIV/AIDS. If you start covering people around the world, you build up just the volume, and that actually can eventually drive down the prices for drugs. Also, many developing countries have engaged in what is called frugal innovation, because you need to find solutions in resource-constrained settings, but some of those innovations end up finding their way to rich countries. So embracing the extension of coverage on a global scale ends up also benefiting, and it benefiting resource-rich countries. And it breaks down this idea that, this other divide between wealthy and poor countries. Because in the end, global action benefits even the wealthiest countries of the world. This is, by the way, what happened with mobile phones. Mobile phones became affordable once they became a global tool. And the fact that we live in a country with 7 billion people and 6 billion mobile phones is actually what makes mobile phones so affordable also in the wealthy countries. So this is another dichotomy that we need to move beyond. So extending coverage for cancer is, in this diagonal perspective, a way of innovating in the financing, innovating in the delivery. It's also a way of innovating a key function of health systems that's so weak in many countries, and it's the stewardship function, the creation of rules that allow us to give general direction. This drama, the numbers, striking numbers that we report of the Task Force on Expanded Access to Cancer Care and Control, authored by Felicia and others, about the enormous disparities in the access to opioids, is a reflection of weak regulatory mechanisms that determines that some of these solutions that are affordable and that would lead even in terminal care for a dignified death for many people who die in horrendous conditions, is a reflection of the weakness of this key stewardship function. And I think if we then focus around, for example, access to opioids to provide relief from pain, you can actually strengthen that. And finally, the ultimate diagonal approach is at the societal level, when we see that cancer is such a focus of stigma and discrimination, as has been mentioned multiple times. Through cancer, we can achieve broader cultural transformation. Cancer is one of the most stigmatized diseases. Susan Sontag wrote a beautiful book called Illness as Metaphor, where she highlighted 3 stigmatized conditions throughout human history: leprosy, tuberculosis, and cancer. She then wrote follow-up to add AIDS to that list. And of course, we could also add mental illness and a number of others. But there's this collection of highly stigmatized conditions. So for a variety of reasons, cancer is one of them. So when we deal with the issues of stigma and discrimination surrounding cancer, we can actually generate a much, much larger benefit. I witnessed this personally when I was accompanying Felicia in her own fight against cancer. We had the opportunity to talk with many women who would tell me that one of the reasons they would not have they didn't have a mammogram early on was because they were afraid that if they were diagnosed with breast cancer, their husbands or partners would abandon them. And it became to me clear that alongside the biological cancer that we try to diagnose and treat, there's a social cancer. And in the case of breast cancer, it is the cancer that deals with reducing women to a part of their bodies. So the fight against cancer is also a fight for the dignity of women. And it can then, in this ultimate diagonal approach, that fight can lead to a larger social transformation, social and cultural change that will not just deal with the problems of stigma and discrimination in the case of cancer, but stigma and discrimination as pervasive problems of our society. And I think we can make some progress, again, if we focus on a particular achievable goal around cancer. So this is what I think we can do by focusing on cancer and then have this great additional effects. I want to close with a 4th keyword, in addition to the ones I heard. And that's the keyword of hope. I think today, for me as dean of this school, is really an incredible satisfaction to see our students so energized and participating. This is the best of higher education. When students take their own education in their hands, I'm sure that many of you who participated in organizing today have learned more in the process of dealing with arranging for this day than in many of your actual lectures. And this is what we try to generate here at the Harvard School of Public Health, an environment where you, in own initiative, can drive the educational process. I want to really thank the student government of our school, Natalie, and you and all of your colleagues for being involved here. I'm delighted to see that SLAP is more is a very constructive force in our school, the students in Latino public health. And of course, I want to thank the other organizations at Harvard, Harvard Global Equity Initiative, the Harvard Global Health Institute, and I can't thank the Global Task Force on Expanding Access because I'm the co-chair, so I don't want to thank them. So, and most of all, I think many students at our school who have, as you just heard, signed this declaration. But I add this fourth keyword of hope because I think if we can mobilize ourselves around the cause of closing this divide, of realizing that in addition to being a major disease and a cause of disease burden around the world, cancer is becoming the new frontier of equity, of the fight for equity, the fight for social justice. I think we can use this as a driver for building a better future. And I know, as some of you said in the panel, that it is being said many times, but students do represent our future. And I can't tell you how proud I feel as dean of being part of a school where we have such a great student body. Someone asked me, how does it compare to be dean and to be minister? And I said, well, you know, they're both very challenging and exciting things. But the big difference is that as dean, I come to work every day and find these amazingly smart people, but also driven and motivated. It's you, the students, that make life at our school so engaging, so encouraging, and that, at least in my case, drive an unsatiable sense of optimism about our future. As you've heard from Felicia and from our daughter, Hannah, cancer is something that also has touched my life. And I did learn that you learn more from living than from leading a health system. But today I will add a third L, and it is learning. Learning. I have learned a lot from each of you, and I thank you for having made this day such a fantastic day, such a great window towards a better future. Thank you very much.